to going over all of that with you. And really a lot of this has been driven by conversations with a lot of you, and very, very excited about this topic in particular. I've been excited about this. It's been on our radar for a while to pull this important webinar as we take a very closer look at guidance for businesses and employers, considering the needs of people with disabilities through the COVID-19 pandemic. And we'll move on to the next slide. And I'm Carolyn Phillips. I am very honored to serve as the PI for the project that we are working on in collaboration with a lot of folks here, and also very honored to be the co-director of the Center for Inclusive Design and Innovation here at Georgia Tech within the College of Design. And I'm thrilled to have Pam Williamson with us. Pam and I go way back, and so Pam, if you'll introduce yourself, that would be great.
Thanks, Carolyn. This is Pam Williamson. I am the Assistant Director of the Southeast ADA Center, and I'm happy to be with you today to share on this important topic.
Thank you, Pam. Liz, if you'll introduce yourself.
Good afternoon, everyone. My name is Liz Persad. I serve as the Program and Outreach Manager for Tools for Life, which is at the Center for Inclusive Design and Innovation at Georgia Tech. And additionally, I also serve as one of the co-PIs for this project today, and happy to be on today's webinar with you. I wanted to take a moment to share some helpful tips for today's session as we're all in this time together. Just wanted to let you know that today's webinar is being recorded. The webinar recording, the transcript, as well as this accessible PowerPoint presentation will be made available to anyone who needs to view the recording. We will be posting that probably within a week on the project microsite, and we'll actually share that link in the chat in just a few moments. Captions are available within Zoom. Please feel free to select show subtitles, or you can click on this link for a full view of the captions. We'll have one of our co-hosts put this link in the chat as well, so those of you that need it can click on it easily. Also just wanted to say hello and give a shout out to Heather Johnson with the CIDI team, who is our captioner on today. If you are not actively speaking, please mute your microphone. Obviously, the host will help you out with that. But again, if your microphone is muted, that just enables everyone to easily hear our presenters today. We also just wanted to let you know that we do have an interpreter on. That video is highlighted. So thank you for being on with us today. And again, you can just reach out if y'all have any questions via chat. Please utilize the chat window throughout today's session to ask your questions or to post comments. We will have an opportunity at the end for folks to ask questions, but please know that we may not get to all the questions. You are able to put that in the chat. You can also reach out to us via email if you need more information or have any questions about today's session or anything that we're speaking on at all. I wanted to share that we are offering continuing education credits for today's webinar. Today's webinar is eligible for CEUs that are approved and distributed by the AAC Institute. We are also offering CRCs, which are approved and distributed by the Commission on Counselor Rehabilitation Certification, or we say CRCC for short. If you are interested in receiving CEUs and or CRCs, you can get them both. Please send an email to training@gatfl.gatech.edu, and I'll get one of my co-hosts to put that in the chat as well. Please know that eligible participants typically receive their credits within 2 to 6 weeks after the webinar. And as always, just reach out if you have questions or need more information. And I'll give this back to Carolyn. Thanks, everyone.
Thank you so much. Just want to give a quick shout out to our funder. Thank you to the CDC Foundation. This webinar series, this webinar in particular, is made possible due to funding from the CDC Foundation, along with technical assistance from our partners over at the Centers for Disease Control and Prevention. And we'll move to the next slide. We are from the Center for Inclusive Design and Innovation. We provide all kinds of accessibility related services, whether it's assisting folks who just have questions about accessibility, and we can consult with them, whether it's built environment or virtual environment. Also providing Braille services and captioning services and services for people who are deaf and have hearing related disabilities. We also provide a high quality, professional e-text production, and we have a certified assistive technology team that is actively on board and really focused on the whole thing when it comes to utility, ease of use, and obviously high quality. So we'll move to the next slide, and I'm going to turn it right back over to Pam. Pam, talk to us about the Southeastern ADA Center.
Thank you. Well, I want to tell you a little bit about the Southeast ADA Center. We're one of 10 centers across the country, and we are part of the ADA National Network. And our mission is to facilitate voluntary compliance with the Americans with Disabilities Act. We're funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, a part of the Administration of Community Living. And we serve the 8 states in the Southeast: Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. And we're proud to be a project of the Burton Blatt Institute at Syracuse University. All right, back to you.
Thank you so much. I appreciate that, Pam. So today's topic is really focused on businesses and employers. And so as businesses and employers of all types continue to operate and or reopen during this time of COVID-19, during the pandemic, there's so many questions. We have a lot of you reaching out and asking questions about how operations can address the needs of employees and patrons with disabilities. So today we're going to get right into that. We're going to explore issues, share strategies, solutions, and resources to prevent and reduce virus transmission, really maintaining that healthy work and business operations, and maintain that healthy work environment. Keep in mind that we're also looking at this through the lens as an employer. We obviously at Georgia Tech employ thousands, tens of thousands of individuals, and have learned quite a bit through our whole process. And so we'll move to the next slide. So what we would really encourage you to do, and we're so thankful for the CDC and the Centers for Disease Control and Prevention and their guidance. So a lot of what we're going to be doing is referring you right back. They have developed and continue to update guidance for businesses and employers responding to coronavirus disease in 2019, COVID-19. That document in particular and those resources are so valuable. This document really does provide an overall roadmap. I have sent it out to so many individuals, especially in the accessible formats that we've helped produce, for the health and safety aspects of reopening businesses. And also, it's going to serve as a framework as we move through this conversation today. This CDC health guidance is supported really by sources of information related to compliance for health and safety, employment laws, and some of those key topics and sources, they include disinfection, which we have done a webinar about, the CDC and Environmental Protection Agency, EPA, safety, obviously, and really the Occupational Safety and Health Administration, looking at that, employment law and Equal Employment Opportunity Commission, EEOC, and then, of course, disability law and accommodations. So regional and also national ADA centers. So we'll be taking that deeper dive with this guidance and this framework. And we'll move to the next slide. So what we want to make sure is that you walk away with tangible information, examples, actionable items. So we want you, as a participant to be able to identify 3 considerations of people with disabilities, so thinking about that as businesses reopen and also are operating during COVID-19, be able to describe 3 tangible solutions for challenges for individuals with disabilities as they experience shopping and other aspects. And then also identify 3 resources for businesses to support health for employees with disabilities while continuing to operate. And we're definitely going to be able to accomplish that today. So we'll move to the next slide. And I am going to turn this right over. Let's see here. In a moment, as we get even deeper, we're going to talk about successful reopening of operations. So you got to plan first. That's extremely important. And we've got to think about accessibility, accommodations, and inclusion. One of the great things that Liz and I have talked quite a bit about is how so much of the planning is work that we've been doing collectively within the disability community. So, and Pam, we were talking about that also. And so I'm going to actually turn this slide and the next slide on over to Pam. So Pam, take it away.
Thanks, Carolyn. So, well, as we have already discussed some, the disability community has been making, talking about various things going on. But one of the things that we have noticed and that the data is starting to show is that 40% of the people who are now jobless have been unemployed for 6 months or more. And that's going to have a lasting impact on not only people with disabilities, but people across the board as people lose their jobs. And now as we see places no longer being able to be in business. Next slide, please. And these job losses here are really impacting people with disabilities, and in a way that they're not impacting people without disabilities. People with disabilities have truly been disproportionately affected by the COVID pandemic and its economic consequences. Just to give you an example, in February 2020, before the pandemic, the unemployment rate of people, of adults with disabilities was 7.8%. And the unemployment of people in January 2021, during the pandemic, just last month, people with disabilities, it was 12%. And unfortunately, we are tending to see those numbers continue to rise. So we know that it's going to continue to have an impact on people with disabilities in a way that it might not affect other people. Next slide, please. Now, there are always concerns about reopening or maintaining your business because with the pandemic, as we know, there is, the susceptibility to getting the virus, to being really sick or having to quarantine. So, businesses are very concerned about this and just whether or not they can even sustain their business. Can we stay open? If we can, how are we going to do it? And also, too, keeping their workforce stable. Are people going to be able to do the job? What are we going to have to modify in order for this to happen? And then compliance with both older laws, and we'll be talking about the Americans with Disabilities Act in a few minutes, and some of the newer laws that have come about as a result of the pandemic. So employees and customers are also having concerns. Are there's income insecurity? Are my hours going to be cut? Or am I going to lose my job? And can I get childcare? If I can get childcare, are they doing what they need to do to protect my child from this virus? And looking at transportation, anyone that uses any type of public transportation or a ride service such as Uber or Lyft, what's going on there? Am I safe on transportation? What do I need to do? And then also, too, being able to continue to access information in a way that works for that person. And then last but not least, the customer. The availability of goods and services. Many people with disabilities have experienced shortages of things above and beyond the toilet paper and paper towel shortages and other things that we've seen. A lot of people with disabilities are having trouble getting medications or getting medical supplies because they're in short supply right now. Again, we've talked about transportation and the accessibility of physical spaces, but the one thing that crosses all of these groups is the health and safety issue. And because people with disabilities can be business owners, employers, employees, or customers, and many times they're in multiple roles. So we need to really make sure that we're addressing these needs. Next slide, please.
Those are such excellent points. Thank you so much, Pam. And what we've been thinking about too, once again, looking through that lens of what works and what's, what needs to be considered. I'm very happy, as I said, here at Georgia Tech, we actually implemented a lot of these things, and it's been incredibly helpful. This resource that was created by the CDC, Resuming Business, the toolkit, what we have found and what we recommend and what we've actually lived here, as an employee with a disability. I was very happy that my employer really identified, and we recommend that people should identify, a workplace coordinator who will be responsible for the COVID-19 issues and their impact in the workplace. We've had constant contact here, once again, at Georgia Tech with our liaison, our person who's in charge, and looking at that from multiple points of view. Also, the willingness and the importance of implementing flexible sick leave and really those supportive policies and getting those policies and practices into place so that everybody understands how this will work. At Georgia Tech, we had a process that you could apply and say, hey, here's what's really going on. And it was very much in alignment with the policies. So it was very clear and public, made available to all of us. Protecting employees who are at a higher risk. With COVID-19, it brought different things to consider than what you would typically consider when we're thinking about folks who are at higher risk with severe illnesses. I'm putting that in air quotes, through supportive policies. So there are folks that did not have, an accommodation or didn't need an accommodation before COVID-19, but they did indeed need accommodations after, or they needed some considerations, different things to consider. Communicate supportive workplace policies clearly and frequently via various methods. I know, I've gotten text messages from my employer specifically about COVID-19. I get emails. We have a Friday update. We've had town hall meetings. We've had webinars about this. And a lot of this is really what has been laid out in the CDC guidance. And we encourage folks to resume, use the Resuming Business Toolkit to analyze and plan and communicate. This is something that needs to continue to happen when it comes to COVID-19 policies and procedures. And I'm going to turn it on over to Liz. Liz, take it away.
Thanks, Carolyn. I'm so glad that you mentioned how proactive Georgia Tech is and our leadership, especially when it comes to the pandemic, and just having a thoughtful, planful approach. And not only because we serve people with disabilities, but because we are considering folks with disabilities in our everyday work, because we are the leaders as well. So it's important to us that we express to all of you how important it is to employ inclusive leadership to plan. This goes back to some of the basic principles in the disability community. Many of you on the line know that we often say nothing about us without us. And so when you are including people with disabilities, people like myself, I identify as somebody who has a physical disability. I use a power wheelchair, and I appreciate when leadership reaches out to me and asks me my thoughts on it. So that way I can help other fellow employees, but also people we serve as well. So strategies can be absolutely more successful if defined through leadership that is including people with disabilities, but also just diverse characteristics, opinions, and just thought processes. And some of the points we have here are just basic common sense, advice and strategies. You want to treat people in groups fairly. Let's not think so much about people or employees with and without disabilities, but how can we treat groups fairly, equally, but also just taking a look at some of those considerations that need to be thought out a little bit more. Personalize individuals. Carolyn was saying how leadership reaches out to her throughout this whole past year about, town hall meetings, just checking in. That happens with me and my leadership as well too. And I appreciate them reaching out and asking me not only how I'm doing, but how can they do better to help, even serve me, and what are my specific needs during this unprecedented time as well. Leverage the thinking of diverse groups for smarter decision making. Again, nothing about us without us. Think about the diverse characteristics within your team. Who are the folks that can bring those collective thoughts and strategies together so we can all have a thoughtful, planful approach moving forward. And just a couple other thoughts here. Preview plans for reopening the business with employees, including those with disabilities, to identify potential pitfalls of proposed methods of compliance or changes. So preview those plans. Again, get others' opinions and see how those guidelines can really coincide with all the things that you've got going on within your business and your place of operations. Meet with people with disabilities, reach out to them to ensure that they understand the plans and policies and that needed accommodations are in place, and make sure that the materials that you're giving your customers, your employees, folks with disabilities are accessible. So no matter what anyone is going through, that they're able to get this important information quickly and on time. So a couple key considerations before reopening. Reopening strategies absolutely include a bunch of different factors, but the focus on health and safety supports our continuing operations. And that's kind of where we are right now, is how are we all moving forward collectively, considering all the changes that have been happening in our lives. So it's important that we consider the nature of the physical facility for those workers who cannot telework. So for those individuals that don't have the opportunity to telework or telework every single day, what does the physical facility look like? What does the office space look like? What does the place of business look like? Are there aspects to keeping safe for COVID, or gloves or sanitizing materials in place? There's just all sorts of things to consider. At Georgia Tech, at my office, they generously installed automatic hand sanitizers, and that's not only around our center, our building, but it's right outside my office specifically, because that is something I often think about and that affects my life in a very critical manner. And so folks sanitize as they're coming in and out, and it's a great way just to keep people safe. And I appreciate Georgia Tech reaching out and making that a priority. The fact that people with disabilities or underlying conditions may be at a greater risk. So just keeping that in mind. And again, just keeping all of these, thoughts and processes in order and just in check. Considering how changes in the business or service may affect health and safety of workers. That's why we're doing this webinar. That's why we're all really getting connected to this project, into this webinar series, is what are the changes that are happening? How can we implement the strategies to, to address these changes, but also what are the solutions in place so that we can help continue to keep people safe moving forward. How to implement the CDC recommended guidance to prevent the transmission of COVID-19. Again, just another reason why we're doing this webinar, but why we're citing the original CDC guidance, because we want all of you to take these materials and these resources, go back, study the guidance, and make sure that you fully understand it. So that way you're able to help us educate others out in the community as well, when it comes to businesses, employees, and serving customers as well. So, and then obviously just how to communicate all of those policies and procedures to all workers, making sure materials are accessible, making sure that they're ready and available in a timely manner to folks that need it the most. And I'll give this to Pam.
Thank you. So, Liz has mentioned many things that we need to consider before looking at reopening our businesses or continuing to have our businesses open during the pandemic. And some of the other things we need to look at is, are there any stay-at-home orders in your state or local area that you need to be aware of? Because there may be things that are impacting the ability of your particular employment workplace to reopen or your business to reopen. So we need to make sure that we're looking at those stay-at-home orders. The other thing is that we've got to look at the severity and the number of COVID-19 cases within the area. We're a large country, so it's going to vary from state to state. It's also going to vary from county to county. And that's something to take into consideration when you're looking at the best way to meet the needs of your employees, as well as to meet the needs of your business and being able to stay open. What are some of the things that you need to do if the cases are higher? Do you need to institute more disinfecting and things of that nature? Whereas in other places it may be lower, and there may not be the same need to do some of the things where they are higher. Then does the business or organization have a physical location? Our office, the Southeast ADA Center, we do have a physical location, but we made the decision early in the pandemic that it was safer for all of us to telework so that we can be safe, because all of us were in the high risk category or lived with someone who was in the high risk category. We also want to make sure you've got the ability to enforce that proper social distancing in the location. If you live in a world like my husband, where you're in cubicle land, what is it going to look like? In his office, they chose to put up high plastic barriers between the cubicles. In addition to that, they spaced people out in every other cubicle, and then also have them doing staggered shifts in the office itself. And so that really made a difference, because otherwise it would have been it would not have been a good situation for him to be exposed to people on a daily basis. And then the other part is the level of contact that workers will have with other employees or customers. What are some things that you can put into place that will help to alleviate any transmission of the virus? And all of those things need to be looked at carefully. Next slide, please. So there are some things that can be done to make the physical workplace safer. First of all, putting in the ventilation system so that there's increased outdoor airflows to minimize the risk. And then also looking at options for improved air filtration. Make sure that air that is coming through is clean, and that it's not, and that the potential for recycling germs is not there. Also, make sure that the safety and the functionality of the water system is intact. You want to make sure that everything is working properly. And then last but not least, always clean and disinfect the workplaces in accordance with CDC guidance. Now, we've talked a lot about the need for communication about policies and procedures. But again, when we're talking about meeting the needs of individuals with disabilities, we've got to look at a variety of ways to make those communications accessible. For people who have vision disabilities, whether they're blind or have low vision, look at doing accessible documents. It can be electronic or digital. It might be embossed braille, large print. There are many ways that that the information can be provided. Could also be done via an audio version. So you need to be able to talk with individuals about what their communication needs are in order to determine what needs to be used. For individuals who are deaf or hard of hearing, so there needs to be the consideration and use of American Sign Language interpreters and videos. Also, too, making sure that videos are captioned So when they're shared, and also in the workplace and in other places where people are going to be communicating with customers, ensuring that they have access to clear masks for people who use lip reading as one of their ways to communicate. There are many clear masks that have now been approved for use, and so I encourage you to look into that option. Although low literacy is not necessarily considered a disability, so it is something that needs to be looked at, because we want to make sure that what we're saying makes sense. The term that is often used is put it in plain language, and I tend to say put it in real people language, something that everybody can understand. So, and then also too, look at multiple ways of being able to share information. Use the company's website, the intranet, a closed circuit TV, or put guidance posters in the workplace. And, there are other ways, email, the text that Carolyn was talking about. There are many ways of making sure that people get information these days, and we want to make sure that we're covering all those bases. Next slide.
Thank you so much, Pam. That is so helpful. So what we're encouraging folks to do, and what once again, building upon what you've heard already, is really plan to optimize worker safety. That's definitely, once again, using Georgia Tech as an example, something that has indeed happened. Planning ahead and getting those ventilation systems in place. I know within our own workplace and within our own team of almost 60 folks, we have thought about our business plan, right, for reopening, and really thinking about how we address preparedness and response and really control strategies, right? So looking at, the uniqueness of jobs, the nature of the job, the environment of the job, that's going to change some of the way that you address some of this. So are there specific things to your workplace? Think about that. Identify areas and specific job tasks that have potential for exposure. If you have a front desk, what are all the different ways, including thinking about, modified ways that people can interact with the front desk, thinking about creating a safe space, and then also including control measures to eliminate or reduce exposures. And we have absolutely done that. If you do not need to be in the office, we do not have you coming into the office. Any changes, by the way, we let people know about those ahead of time, and we send them out in an accessible format. So some of our folks, we have a wide range of folks, some with disabilities and without disabilities, that work obviously with us, and making sure that we're sending out information and posting it so that folks can listen to it ahead of time so they can prepare for the workplace, know of any changes, know if we've adjusted the workspace. When you have people who are used to and have learned a workspace that might have a vision-related disability or that might be blind, it's important to also make sure folks are aware of what's changed. If you're, and you should be implementing a lot of space, more than 6 feet, making sure that folks are aware of those changes also, so that they are ADA compliant, that you have communicated it, and you have an inclusive but also accessible and a safe workspace. Pam, I'll turn it right back to you.
Thank you. Well, we've been talking about various ways to implement things that are for the worker safety and employee safety, but also customer safety. But one of the things that we have seen a big change in, or at least an enhancement of over the last several months, is in our retail area. Now, one of the things that has really been interesting for me to watch as a person with a disability, and also as a person who has been in the disability arena for well over 30 years, is that things that were once considered special or reasonable modifications and may have received some pushback because a person with a disability asked for them, are now become more commonplace. And we're talking about the ability to be able to buy online and pick up things in this at the store, or to be able to do curbside pickup, or to having special or designated hours for people with disabilities or older adults to be able to shop. I've benefited from this in my own life, and that my local pharmacy that we use, I now, if I need any type of medication for the family, I call ahead and say, hey, I need this item, and I'm talking over the counter medication, not prescription. I need this item. Can I pick it up at the drive-through window? And because that keeps me safe, keeps my mother safe, and it keeps the people inside the store safe. And it really has made a difference. So next slide, please. Some other things that we've seen are the ability to do curbside check-in, and this is at multiple places. I have watched this happen at my doctor's office. So in that I do check-in before I get there, and then I will, so that we don't have to wait in the waiting room, they either text me or call me and let me know when my mom and I need to go in. So there's that way we have minimal exposure to the other people who may have the virus or other things. We've also got the drive-through services. I was talking about that with my local pharmacy. And then also the ability to be able to do live chat, video appointments. The other thing is that a lot of businesses are now using apps for people to be able to communicate if they're deaf or have vision loss. So there's so many things that are now in place that we have not seen in the everyday world, especially in the retail area. Now, and so it's really exciting to me to see that these things are becoming more commonplace, and they're becoming accepted, and really I believe are going to change the face of business all the way around. Next slide.
Thank you, Pam. I am smiling because I am hearing you talk and I hear the excitement in your voice. And again, as somebody living with a disability, these are all things that I've utilized. My, friends and other professionals that are just like me have utilized. But it's nice to see that this is becoming kind of commonplace, and hopefully these are all things that will be staying in place, implemented for folks to use long-term moving forward. We just wanted to share some helpful tips, obviously, and some considerations when it comes to modifying the workflow and procedures as needed for your business reopening. Definitely assess the hazards for each job. And I would even take that even further and just say, look at the day and look at kind of how the business flows for the day and what that means for assessing the hazards for each of the jobs and each of the tasks every day. It's important to minimize sharing of spaces and tools. So whether it's sanitization or the fact that somebody might be dedicated just to one area and not having, others mixing in that area as well too. So just some basic things to be thinking about. When it's possible, minimize contact with customers or delivery people. So maybe there are other ways that, delivery individuals can leave packages on a table somewhere that makes it easy and accessible for your employers to go grab them, but not having to have actual contact with those folks as well. Take a look at the workflow and interior traffic patterns to minimize contact. Again, it's kind of funny just thinking about that, because as somebody who drives a power wheelchair, I'm always thinking about the workflow and traffic patterns at work, and just different avenues I'm taking to get from one meeting to another, or just accessing the different floors and different rooms and what have you. But definitely it's important to think about that as we are trying to minimize contact with other individuals, but just certain areas as well too. Hold virtual meetings when possible, or hold meetings in open, well-ventilated spaces. I think, the most important thing there is if you're able to be virtual, make that happen. And if not, just be thinking about the space, make sure it's an open area, make sure it's well ventilated, encourage folks to continue social distancing and obviously to wear their masks. And as always, if it's possible, please provide protective personal protective equipment or PPE suitable for the tasks, masks for everyone, gloves, gowns, shoe covers, or other PPE as needed. And again, just taking it a step further, making sure it's in an accessible space. I gave the example earlier of how our center has motion censored, activated hand sanitizers. So I'm able to roll up very easily, get some hand sanitizer, masks, all those other items I may need. They're all placed in areas that I could easily roll up to and grab as well. So just making sure that folks are aware of where all of these items are located, make sure they're accessible, or that I'm able to be aware of it and I can instruct a caregiver or an assistant where to go easily to access these items. So avoid unintended consequences. Consider accessibility and also that legal compliance before converting accessible parking spaces to additional outdoor dining spaces or order pickup. I can't tell you how many times this has happened during this pandemic. It happens kind of in general anyway, but please be very mindful of that. Just because you don't have your typical flow of traffic in your business doesn't mean that that doesn't include people with disabilities. And if somebody is driving to your business or being driven to your business and they need an accessible parking space, they're going to need an accessible parking space. So I will say that we have definitely seen those spaces being taken up by additional, dining spaces or just, that curbside pickup. But those accessible spaces are there for a reason. And it's important that we just don't, eat that up. Provide alternatives to leaving seniors or people with disabilities waiting in long lines that they cannot manage physically. That's something that we've actually been hearing lately, just about folks that are having to wait in long lines. They don't have seats to sit down on. Maybe there's a better way to set up a communication method so they can wait in their car. I had to get blood drawn not too long ago. I was nervous about going out and just doing an invasive procedure, something I wouldn't have worried about, not too long ago. But I was able to check in while I was in my van. They sent a text, said, "We're ready for you." I did not see any other individual as I made my way into the lab and worked with the person that was there taking my my blood and just doing all the medical procedures that needed to happen. So possibly just setting up a point of a way to communicate would be very helpful. Be sure that furniture removed to allow for social distancing does not become a barrier for someone to access it elsewhere. So plan to store furniture out of the way. People are moving furniture around. They're making spaces more open, easy to navigate. So that way folks can stay 6 feet or more apart, but just be mindful as you are moving furniture. There are folks using wheelchairs, canes, crutches. They have assistants with them. They have service animals with them. So just know that often if you are somebody with a disability, that you just need a little bit more space. And so appreciate just the thoughtfulness there. Be careful that people waiting for access to the building are not blocking those arriving for pickup or waiting to exit. Plan a flow that does not result in groups congregating. You definitely don't want a pileup of cars and vehicles waiting to pick up items or individuals, and then you just end up with a mass of people right outside your front door of your business, if you will. But again, these are just all very thoughtful ways just to consider your strategies. And really, at the end of the day, it just goes back to looking at your business operations and your workflow and just planning for COVID during that time. All right, so we're going to move along to making plans to prevent and reduce transmission among employees specifically. And I'll give this to Pam.
All right, great. Thank you. So, we've talked a lot about the different protective measures, and we've heard these many, many times over the past several months. So, but just as a quick reminder, so, wear a mask. So unless it's a respirator or a face respirator is required for the job by CDC guidance or OSHA regulations. Also remember social distancing from other workers or customers. Wash our hands frequently. So I know my ABCs and Twinkle, Twinkle, Little Star very well now, because that's what I sing in order to make sure I do my 20 seconds of hand washing. And then get vaccinated when possible. We know that the vaccinations are out there and they're coming. So, that will be another step that you can take either now or in the near future. Next slide, please. We're going to address an issue that's been really a hot topic of discussion over the last several months. And these are face mask policies, particularly in private businesses. And so just as a reminder, CIDI has done a webinar on face masks previously. But this information is from a white paper that was developed by the Southeast ADA Center, and we reviewed guidance from CDC as well as many other organizations to ensure that we were providing the best information available. First of all, this is a reminder that a private business may require customers to wear a mask to limit the spread of COVID, because this is a pandemic, and it has been looked at as something that can be a direct threat to the health or safety of others. However, it varies from state to state and even local counties and cities and towns as to how many, where the masks are required in the state and local government areas, or even whether or not they require businesses. As of February 8th, Tuesday, 36 states, the District of Columbia and Puerto Rico, were requiring the use of a face mask when in public spaces. So that's, and that number varies from week to week. Some states have had a mask mandate in place and dropped it. Others have either added one or have never had one. However, there are situations where a person with a disability might not be able to wear a face mask. And so it can be so that it's either because of the disability that they may not be able to wear it. They may have PTSD. They may have some type of physical disability that prevents them from being able to wear it. But if that is the case, we need to be able to look at reasonable modifications. Under the ADA, it's a reasonable modification to a policy, practice, or procedure. So if a private business has a policy, so stating that a person must wear a face mask in order to enter their business, then they need to look at reasonable modifications that allow the individual with a disability to be able to get the services. So let's look at what reasonable modifications may look like. So if you can take us to the next slide, please. Some of these are going to look familiar to you. And this is because we talked about them earlier, and the fact that a lot of things in the past that have been considered special or just for people with disabilities have now become more commonplace. So some of the examples of reasonable modifications to a face mask policy so that an individual can receive the service or goods that are being provided is to allow customers to order online, do curbside pickup or no contact delivery. Allow them to order by phone or the internet or some other way and do either pickup or no contact delivery. Allowing a person to wait for an appointment and then enter the building when they're called or texted, or offering appointments by telephone or video calls. These are just very basic examples, but again, they're common sense, they make sense, and they're really becoming more commonplace. At the end of the day, if you'll take me to the next slide, we need to focus on how a customer is being served, because it's all about providing the goods and services in an equitable manner. So focus less on the fact that the person cannot wear a face mask and more on how do I provide reasonable modifications under the ADA so that this person can have the services that my business provides. And be thinking about that and go ahead and plan ahead. We've talked about that. What are some things that you can do? What are some things you're already doing? And really look at that issue so that you can make sure that you are serving all customers, including customers with disabilities. Next slide, please. So let's change gears a little bit. We've talked about private businesses, but there are going to be the need for accommodations in the workplace. We've got two issues that have really come to the top over the past several months. We have individuals with disabilities who need reasonable accommodations in order to be able to do their job because they're in a high-risk group. And we have individuals who have disabilities who have never disclosed their disability, but now because they are in a high-risk group, they need an accommodation. They need to be able to have a reasonable accommodation in order to be able to continue to work. And actually, there is a third thing, and this is people who have had COVID are now having the long-term effects that may be rising to the level of disability. When we look at all of these issues, we have to look at them on a case-by-case basis. That is the most important thing when it comes to addressing reasonable accommodation requests. You can't make blanket decisions about what will and won't be done because it's focusing on the individual and what he or she needs in order to be able to do their job and continue to do their job. And I want to emphasize the most important thing an employer and an employee can do when an employee needs a reasonable accommodation is to engage in what the EEOC, or Equal Employment Opportunity Commission, calls the interactive process. This is an informal discussion, and really and truly it is a conversation so that the employer and employee can decide the best accommodation needed in order for that employee to be able to continue to do their job. I can't emphasize that part enough because so many times things break down early in the process because these conversations are not held. And the important thing to remember here is that the employer is the one who gets to make the ultimate choice on what the reasonable accommodation might be, as long as it's effective. And there can be a variety of accommodations, and many things that have happened over the past several months have shown this. We've done telework. We've got some people now who are working in cubicles, but they're now working in enclosed offices so that they can maintain social distance. We have seen the rise in the need for captioning because we've gone to virtual meetings. So, and I'm loving the fact that now that we have sign language interpreters in our meetings. So without having to fight for it, it is really a boost for those of us that have hearing impairments and need these accommodations. Now, the only reason an employer might not have to provide an accommodation would be because it causes an undue hardship. And that's the short definition of that is that it's a significant difficulty or expense. And it's not just a financial difficulty. It could also be something that's, unduly disruptive, or it's going to fundamentally alter the nature of the operation of the business. It's going to be very difficult for a grocery store to allow a stocker or a cashier to work from home. That's not the way it's done. So there's got to be other pieces to be looked at as to what accommodations might work. And then, of course, the other issue that comes up is that employers can exclude people from the workplace or deny a reasonable accommodation. So because they pose a direct threat. And based on the CDC guidance and since March 2020, the COVID-19 pandemic definitely meets the direct threat standard. So that's something that has to be looked at very carefully. Now, we could spend another webinar in and of itself on the reasonable accommodation issue. So that's going to be your short overview of that for today. Next slide.
Thank you so much. That is so helpful. And I love all the specifics, all the details. Thank you. So when we're optimizing workflow for safety, we've often been re-engineering the workplace, and that really is about proximity. So it is those tangible things and some of what you've been sharing, and also what we're seeing in the chat. Even if we're in the same workplace, in still going ahead and having your meeting via Zoom or what have you, because you don't want to be in that physical space necessarily. If you can do that, or using large conference rooms to host some meetings that would typically have been in smaller conference rooms, and all of that really reducing the exposure. We'll move to the next slide. There's a lot of cool technology out there that we just want to make sure is on your radar. Some really good resources that we're going to go through as we move along the rest of this time together. Some apps that help with social distancing. Space social distancing is an app. 1.5 is an app. The iPhone 12 actually Pro has a people detection app. These are all things that we've been needing, and I'm so glad that they're here. This really does help a lot of folks, but especially some of our folks who have a difficult time telling how far somebody is, or who are blind or have low vision. So we'll move to the next slide. Some more strategies when it comes to preventing spread. Really thinking about the hand washing, making that, there's a great point. I carry it on me. I know a lot of folks actually that can carry it with them. A friend of mine who uses a motorized wheelchair actually has hand sanitizer attached to their chair, which is great. So considering those hands-free sensors, we have those throughout our building now, which is great, and paper towel dispensers, all of it, and really eliminating 1 point of possible contamination, and going through strategically and looking at all of those. Lots of tangible solutions there, and we'll move to the next slide. So travel precautions. Really, what we are doing, and what I know a lot of folks are doing, is minimizing non-essential travel, really just doing it. Checking the travel planner for state and local, tribal, territorial restrictions is extremely important. We also encourage folks to advise employees to check themselves for symptoms before traveling. And once again, using teleconferencing to avoid traveling can be very helpful. Lots of great information, once again, with the CDC. Commuting to work is another important one. I'm going to turn it to Pam for this, and then we'll jump right back to me. Pam?
All right, great. So, there are many people that use various types of public transportation, or as we mentioned earlier, shared rider systems such as Uber and Lyft. And these are things that need to be looked at, especially for people with disabilities that may have difficulty social distancing if they use public transportation or carpools. And also, too, some public transportation systems have limited their operations or cannot carry as many people because of social distancing. So we've got to look at different ways of accommodating employees and looking at what can be done so that employees can still get to work or still be able to work. So there may be alternative methods of the transportation. Is there another way the person can get to work? Can the employer work it out with the employee so that they pay one person to bring them back and forth to the workplace? Or is there another way that they can get to work and so that they can limit their exposure? Changing work hours. That's one of the easiest things many times to do, is to change work hours or to stagger work shifts in order to be able to minimize exposure. And that way you can ensure that people are able to still do the job, do it well, and then that way they can you still, as the employer, still get the benefit of having a valuable employee. And in many situations, telework is an option. For many of us, we have been teleworking, but it may be that there are situations where teleworking every day is not an option. So can it be a situation like my husband's where they work every other day, and still it minimizes the exposure, and so that people don't have to deal with the transportation issue quite as often.
Thank you so much, Pam. So as we're wrapping up, some things to consider. Make sure you have policies that, and they should be changing. Your policies should be changing because of COVID-19, especially as you're working with your employees that have disabilities. They may include things like general hygiene, social distancing, what to do if they get sick. So all of that, and we'll move to the next little section here. So as you're thinking about this, encourage people to stay home if they're sick. We have done that for years within our workspace, and it's great to see collectively the community doing that. We also have testing stations at Georgia Tech that are set up, and people can go and get tested, and really encouraging people to isolate. If they have symptoms, isolate, and it makes a lot of sense. We are also very much encouraging people to, use that CDC guidance to perform those checks. There's some great information out there when you're screening for symptoms, using those contact-free thermometers, things like that. Very, very simple. And also thinking about separating employees if they have been sick, and paying attention once again to how long symptoms can last, and just being mindful of all of that. And we'll move to the next. If the employees are essential workers, there's a bunch of great guidance and very, very helpful that once again we've been sharing with so many folks from the CDC about essential workers, and the COVID vaccine communication kit toolkit specifically for essential workers getting started is incredibly valuable. So we want to make sure we point you to that resource. And some of the things that y'all have mentioned in the chat, it's absolutely invaluable, and we have to think about protecting everybody. The masks and all of those different things that y'all have been bringing up, very helpful. Also, another great information resource here, information for community-based organizations. Once again, looking at the toolkit, and it definitely helps when it comes to educating folks about vaccines and the importance. I know I can't wait to get mine. Raising awareness about the benefits, and encouraging people. It's absolutely, let's ask the question and get the answers. And we'll move to the next slide. Lots of great guidance for employers. It continues to evolve. Lots of great information when it comes to responding, as we said, and those essential, workers getting started. It's right here, and there are links, and I'll ask my co-host to put those links in the chat, and we'll move to the next. So as the guidance continues to evolve, please, we're always looking for, solutions, things that you have tried, things that work. Please keep sending those our way. A couple of you have already texted me as we were presenting here, and also emailed. Please keep that going, and make sure that, business owners, you as a business owner, employees, you as an employee, are aware of those ever-changing COVID-19 guidance. We're learning a lot, which is good. So new information about COVID-19, there's still so much to learn about the virus, possible immunity after having it, nature of long-term effects, all of those things. So stay informed and stay flexible, and know that, as the new administration is implementing some of this, there's a lot that we must wait and see how much of it's going to be proposed, and that plan is going to be funded, and we may be affected by how it's implemented too, and hopefully all in positive ways. And we'll move to the next. So safe shopping. I'm going to turn this to Liz as we wrap up. Liz, take it away.
Yep, so we're almost done, and we just have a couple of tips for strategies when it comes to safe shopping. Try to schedule shopping and service visits at a time when you encounter fewer people. That can be certainly early in the morning has been some of the best times, or being able to access that first appointment. Patronize businesses that have reconfigured with the customer in mind. You know, we often talk about that, you know, outside of just the pandemic world, is that, you know, money speaks. And when you're going to accessible businesses, you're telling them, hey, we appreciate what you're doing. If you're going to an inaccessible business, you're saying, gosh, you know, what does that really say about keeping people separate? So entertain businesses that are really keeping people safe, and that they're really putting all these guidelines and implementing, you know, social distancing, wearing your masks. Consider your transportation options and how they affect potential contacts. Can you walk? Can you bike to your shopping or appointment? Are you able to drive alone? If you use public transportation, go when it's less crowded. So lots of helpful tips out there. And we just encourage everyone to be flexible, continue to stay safe, and obviously just continue working on your strategies in order to do so. All right, so we've come to the end of our webinar. We do have a brief survey that we wanted to put out there. We appreciate everyone's comments and questions in the chat. We are at the end of our time, but please know that you can email us, and we'll have our host put an email address, training@gatfl.gatech.edu. Please know that you can get in touch with us through that email address. If you have a need for credits, CEUs, or CRCs, have any questions or comments about this webinar, or just need anything in general. And then I'm going to go ahead and turn this over to Carolyn.
Thank you so much. Pam, thank you so much. That was outstanding. Trish Redman, oh my goodness, really appreciate you and everything that you've done to help pull this incredible webinar together. And thank you so much to Sam and Tori for doing such a great job, and Sarah behind the scenes and making it all happen. We appreciate all the feedback and all the positive feedback that you have been sending our way. We do hope this is something that you will help share and get the information out there. Liz, awesome job. Thank you. And thanks to, once again, our funder, CDC Foundation, for making all of this happen. So we'll just encourage you to check out our other webinars. We've covered a lot of the topics that y'all were asking about in the chat. Those are resources you can access and also share. And know that we're very appreciative of you spending your time with us today. Stay safe and be well, and thank you so much. Take care, everyone.